Well, it's my pleasure to welcome everyone and let you know that you're tuned in to Hawthorn University's Holistic Health and Nutrition webinar series. And I sure want to thank you for joining us as we welcome John Ramotowski for his presentation on the role of endocrine disrupting chemicals in childhood obesity. And John, it's just so great to have you presenting for Hawthorn. I'm so excited about this.
Thank you so much, Paul. I really appreciate the opportunity for this, and I thank Hawthorn and all the professors and everybody who's here listening. Thank you.
Absolutely. It's such an important topic. It's so timely as well. So I want to let the audience know a little bit more about you.
Okay.
John is a certified holistic nutrition consultant, a personal training specialist, and health educator. John holds a Bachelor of Arts degree in economics from the University of Lethbridge. He pursued his passion in nutrition and graduated from the Canadian School of Natural Nutrition in 2012. He also holds a Master of Science in Holistic Nutrition from the American College of Healthcare Sciences. And John is currently working on his Doctorate of Science in Holistic Nutrition at Hawthorn University. And through his personal consulting business, Me to the Max, John helps clients discover that small daily incremental changes can lead to optimal health. His goal is to help people build sustainable change to live their maximum life. And I want to just let you know a little bit about the presentation because John's going to help us understand that childhood obesity has grown significantly over the past few decades, and endocrine disrupting chemicals are suspect in a child's environment. These EDCs can raise the risk of juvenile obesity because they can disrupt processes that are essential for growth and development. Therefore, it's essential for us to keep educated to help avoid the damaging effects of EDCs for a child. Many hormonal changes are occurring during childhood development, so minimizing any harmful effects must be a priority. The goal of this presentation is to assist us in gaining a better understanding of possible prevention and mitigation of EDCs and to support the optimal health for children and to reduce the obesity epidemic. All right, there's a lot there that we're going to cover and we don't want you to miss a thing, so this presentation is being recorded. It'll be available for replay on our website in just a few days. We'll likely go up to 75 minutes for the presentation and we'll follow that with your questions. So please don't wait till the end. You can write your questions or comments into the webinar question panel at any time, and we'll certainly respond to your questions or comments at the end. I'm your host, Paula Bartholomew. I'm one of the founders of Hawthorn, and now with all that said, it's time for John Ramotowski. All right, John, back to you. It's a pleasure to have you with us. I'm so eager to learn more from your expertise that'll support us to understand and actually incorporate this information. So thank you so much.
Thank you so very much, Paula. That's a great introduction. I appreciate it. Thank you. Thank you, everybody, for joining in and listening to me speak for over an hour, almost an hour and a half, maybe. Who knows? But so today I'll discuss the agenda just briefly, and then I'll go from there, and then we'll start into the presentation. So I'll discuss a little bit the statistics in correlation to EDCs or endocrine disrupting chemicals, threats to the global health burden, initiatives for mitigation, and I'll talk about that from the household family level as well as from the policy government type level, defining the endocrine system, understanding the correlation between endocrine disrupting chemicals and childhood obesity is an important one that I'll go over. And of course, that's what the topic is today. So, and then I'll discuss the chemicals that are involved. The major ones, I won't go into all of them because there's so many of them, but I'll discuss the major ones. I'll discuss transgenerational effects. So, meaning is what you or a parent can do will affect or can affect your child and their children as well. So, lifestyle, etc. Talking a little bit about challenges to making inferences about EDCs and child obesity. There's so many different concerns that come up, and I'll discuss that. Conclusions, proposals for recommendations, and exploration required to solve this crisis of obesity and also the EDCs. So learning objectives today will be, first of all, to define the endocrine disrupting chemicals, review of EDCs and their sources, understanding the correlation, again, between EDCs and childhood obesity, summarize mechanisms of action and how EDCs and what they do in order to create that obesity and what they do to the body and the various systems. Highlight transgenerational effects, mitigation strategies, proposals for recommendations I'll go over as well, and highlight exploration required to solve the crisis. So I'm going to start off with some information that we know about and some stats as well. So child obesity has grown considerably, a lot over the past few decades, especially since the 50s and 60s. And a big suspect is endocrine disrupting chemicals in an environment of the child. EDCs are particularly damaging to children because they're smaller and lighter as a size of a person compared to an adult, and they're affected more by the environment and chemicals. EDCs can raise the risk of juvenile diseases because they can disturb processes that are critical for growth and development. When growth and development occurs, you have a lot of different changes that go on through various systems and hormonal balances and changes, etc. So there's many ways a child can be affected by EDCs that can stem from maternal exposure, inhalation, skin contact, and they can lead to transgenerational health concerns. And there's ways of mitigating these through support that can assist in reducing harm. So mitigation of risk can be possible as well through education, environmental impact assessment, environmental agencies, and screening. Increasing awareness is vital. So that's the big thing here, is what I'll be talking about a lot of is increasing the awareness and responding to the concerns that EDCs may bring in regarding a child's health. Discussion around childhood obesity and health concerns stemming from this are essential. So topics how they enter the body, to what they do to cause obesity and other risks, and I'll be reviewing that. So it's critical to note transgenerational effects and other effects may be unknown at this point. There's a lot of things that are unknown in this world, and then later they're found out that they caused an issue. So further examination will be on how to help offset these concerns with educational, nutritional choices and the impact government agencies have that are related to EDCs. So again, like it's been raising, the level of obesity has been rising sharply throughout time, and evidence has been emerging over the last few decades that human exposure to numerous EDCs is connected to childhood obesity and obesity-related metabolic diseases. So many EDCs are synthetic chemicals circulate into the ecosystem. So these are exogenous compounds that interfere with hormonal regulation and normal endocrine systems, which affect the health of humans, especially kids. So statistics on child obesity and correlation. So over the past 40 years or so, obesity has risen dramatically in children and adolescents around the world. In the US alone, it's risen to 3 times, with a prevalence of 17% in preschool children. And for kids that are 2 to 19 years old, the prevalence of obesity was 18.5%, and it's affected about 13.7 million children and adolescents, and this is in the US alone. And obesity prevalence was 13.9% amongst 2 to 5-year-olds, 18.4% among 6 to 11-year-olds, and 20.6% among 12 to 19-year-olds once you get into the teen years. And so childhood obesity is becoming common among certain populations. So socioeconomic status, and I'll talk a little bit about that, and I've broken it down to different levels. So prevalence of obesity decreased with an increasing level of education in the household head. So once a parent's education level, the obesity has decreased from the ages of 2 to 19. But obesity prevalence was 18.9% among children and adolescents aged 2 to 19 in the lowest income group, and 19.9% amongst in the middle income group, and 10.9% in the highest income group. So obesity prevalence is lower in the highest income group amongst non-Hispanic, Asian, and Hispanic boys as well. And prevalence was lower in the highest income group among non-Hispanic, white, non-Hispanic, Asian, and Hispanic girls. So obesity prevalence did not differ by income amongst non-Hispanic Black girls as well. So is childhood obesity considered a problem? Really, is it? So you'll find out that it is. Obesity during childhood could harm the body in a variety of ways. So children who have obesity are more likely to have concerns that they could have them now, but they could also develop them later as a more of a statistical percentage. So high blood pressure and high cholesterol are risk factors for cardiovascular disease. An increased risk of impaired glucose tolerance, insulin resistance, and type 2 diabetes. Breathing problems such as asthma and sleep apnea, joint issues and musculoskeletal discomfort, fatty liver, gallstones, gastroesophageal reflux, so heartburn. So this could lead to a lot of psychological concerns like anxiety and depression in children, low self-esteem, lower reported quality of life, and social problems like bullying and stigma from other children. So this causes a big threat to the global health burden as well. So it was achieved that probably over 20% of an attribution to chemical exposures regarding childhood obesity is associated with these EDCs. So that's quite a large percentage. And we'll go more into that detail of that as to why that is. And it's actually probably even a low percentage compared to what it actually is. So the estimated cost connected with obesity with one of the phthalates contributing most of the cost. So it's $20.8 billion of costs. So total costs of the exposures in the European Union and the US have been estimated to be 217 billion, and the other ones in European euros, and 340 billion respectively. These numbers these are a minimum, like I said, as calculations were carried out only for substances and outcomes with a high probability of causation for which exposure data was available. So substances like mercury, pesticides, brominated diethyl ethers, and several endocrine disrupting chemicals as serious health challenges need to be challenged, these hazards. Environmental burden of disease assessments are underestimated, primarily when focused only on risk factors with detailed documentation and when ignoring adverse effects beyond specific disease risk and mortality. So childhood obesity greatly adds to the total environmental burden of disease, and that the total costs are substantially higher than those calculated in terms of the losses that are linked to specific medical diagnosis. So political initiatives about for mitigation of EDCs. So there is an endocrine disruptor screening program. It uses a two-tiered approach to screen pesticides, chemicals, and environmental contaminants for their potential effect on estrogen, androgen, and thyroid hormone systems. Keep in mind, there's a lot more hormone systems than those, but they are focusing on these hormone systems. So the EDSP is outlined in 2 Federal Register notices published in 1998. So Tier 1 is used to identify substances that may interact with the endocrine system. So chemicals that go through Tier 1 screening and then are found to possibly interact with estrogen, androgen, which is a male hormone, and thyroid hormone systems will proceed to Tier 2 for testing. Tier 2 testing data identifies any adverse endocrine-related effects caused by the substance and establish a quantitative relationship between the dose and the adverse effect. So quantitative, keep in mind, quantitative is numbers and qualitative is the other substance where you're looking at things where it could be a person's opinion, etc. So the results of Tier 2 testing are combined with other hazard information and exposure assessment on a given chemical, resulting in the risk assessment. So risk assessments are used to inform risk mitigations, measures as necessary, and regulatory decisions concerning chemicals are made. So EDSP is mandated to use validated methods for these screening and testing chemicals to identify potential endocrine disruptors, determine adverse effects, dose response, assess risk, and ultimately manage risk under the current laws. So these methods or assays allow EPA to identify and characterize the endocrine activity, specifically estrogen, androgen, and thyroid of pesticides, commercial chemicals, and environmental pollutants. So let's get into definition of the endocrine system. So the endocrine system contains several glands in the body, which do not have ducts or other comparable structures. So the endocrine system includes the ovaries, the testes, the thyroid, the parathyroid, the adrenal gland, the pituitary glands, the pineal body, the pancreas, as well as cells releasing hormones found in the gastrointestinal tract. There's other glands as well that secrete chemicals called hormones, but the other glands which produce other chemicals such as tears, saliva, sweat glands, etc. The types of endocrine disruptors and their sources. So endocrine disruptors are found in artificial chemicals, for the most part, used in industrial solvents, lubricants, and their byproducts. So one of the largest sources for EDCs are effluent from sewage treatment plants. A lot of the plants dump sewage into the rivers or waterways, etc. And these facilities often don't eliminate micropollutants completely, and thus are important sources for these substances. So these include polychlorinated biphenyls, so PCBs, polybronated biphenyls, PBBs, and dioxins. So other ones include bisphenol A, BPA from plastics, DDT from pesticides, vinclozolin from fungicides, and DDS from pharmaceutical chemicals. So certain metals such as cadmium, mercury, arsenic, lead, manganese, zinc are also known to disrupt endocrine systems. So many cosmetics as well, like many products, like cosmetics, personal care products, cleaners, especially the ones that really smell, give a good like a smell to make things smell nice. Be aware of those type of things. Contain complex combinations of chemical that have endocrine disrupting actions. So how do they pass into the body? So exposure occurs through drinking contaminated water, breathing polluted air, ingesting food, or contacting contaminated soil. People who work with pesticides especially, or fungicides and industrial chemicals, are particularly at a higher risk, and thus they could develop a reproductive or endocrine abnormality. So getting to the root of the discussion here. So endocrine disruptors and obesity in children. So maternal exposure to EDCs usually occurs via ingestion of contaminated food or beverages, contact with personal care items, plastics, or other products that contain these chemicals can also contribute. So these chemicals can be transmitted to the fetus across the placenta, or to an infant via breast milk, compared with adults. So comparable levels of exposure as a function of body weight are higher for fetuses and infants, and exposure to low environmentally relevant levels can program lasting effects. Some EDCs can influence adipocytes or fat cells to promote adipogenesis, and low levels of these chemicals could create increased susceptibility to obesity later in life. Emerging epidemiological and biological evidence suggests that rapid weight gain during infancy or later childhood could be related to the maternal or early life exposure to EDCs. And exposure to environmental contaminants like BPA, DDT, phthalates, pyrofluorotonic acid, or Teflon. So Teflon's a big one as well, and dioxins during pregnancy are more likely to give birth to offspring that display a lot of fat accumulation leading to obesity. So the mechanisms of action that are related to EDC or childhood obesity. So EDCs alter endocrine function by acting as an agonist or an antagonist of the receptors, such as the estrogen receptors and the androgen receptors, example like testosterone, thyroid receptors, aryl hydrocarbon receptors, which regulate gene expression. So EDCs play a role in regulating pregnein X receptor. So that's a constitutive androstenedione receptor, and the peroxisome periphylator actor receptor, so PPAR, which act as an activator of other nuclear receptors. So pregnein X senses the presence of a foreign toxic substance and then upregulates the expression of proteins involved to deoxidify or clear out, detox and clear these substances from the body. And if these are changed because of EDCs, they can't do that, which could lead to obesity and other issues. So AHR is the main receptor binding dioxin-like chemicals, and thus are frequently called dioxin receptors. So nuclear receptors mentioned above, like the ERs, AHR, and PPAR, are also present in mitochondrion. And many EDCs are found to move into the mitochondrion and disrupt mitochondrial function. Of course, we know what mitochondria does. It's the powerhouse of the body. And if we don't have those working properly, then that's going to create an issue as well. So I'm going to talk about a little bit about this slide. So EDC, so basically 3 different situations here as per figure 1. So when absorbed in the body, an endocrine disruptor can raise or lower normal hormonal levels, so left, or mimic the body's natural hormones in the middle, or alter in the natural productions of the hormones, which is the right. So they can start the same processes that the natural hormone would start. So other EDCs block normal hormone binding and thereby prevent the effects of natural hormones that come in. Still, other EDCs can directly interfere with the production, storage, release, and transport, or elimination of natural hormones in the body, which can greatly affect the function of certain body systems. So this is why it could affect people in many ways. So in addition to childhood obesity, it can disrupt sexual development, fertility, birth defects, immune responses, especially of kids. That's important today with COVID. Neurological and behavioral changes, including reduced ability to handle stress, which is big too in this day and age. So mitochondrial dysfunction and oxidative stress. So mitochondrial dysfunction can promote the development of cardiometabolic diseases, including obesity. And mitochondrial dysfunction increases accumulation of diaglycerol. So it's a metabolite of fatty acids. It's a fatty acid metabolism. So it could increase the accumulation of fatty acid metabolism. So, you know, obese mice is an example. Exposure of a PCB combination impaired mitochondrial function and raised adipokines level, which is which could mediate inflammation and insulin resistance. And a study in mice demonstrated that visceral obesity, insulin resistance, and glucose intolerance occurred when mice were fed salmon and contaminated with PCBs. So oxidative stress also contributes to the development of obesity. These EDCs can induce adipocyte differentiation and lipid peroxidization, leading to obesity and metabolic syndrome again. EDCs increase the transcriptional activity of PPY, AR gamma, and CEPB alpha, which are vital transcriptional factors for adipogenesis. And I'll talk a little bit about that in detail to explain what that means a little bit later on in the next coming slides. So that's vital for transcriptional factors for adipogenesis. EDCs are linked to a variety of outcomes of potential relevance to obesity. So including stimulation of adipogenesis and changes of insulin secretion, insulin sensitivity, and liver metabolism. So understanding the correlation between EDCs and childhood obesity. So the increase of human exposure to EDCs parallels the rise of child obesity rates in the United States, creating a possible underlying link between the two. Many of these chemicals are classified as EDCs based on their capacity to mimic or alter receptor signaling by endogenous hormones, so including estrogen, testosterone, thyroid hormone. Evidence of a link between EDC exposure and obesity risk began with the in vitro effects on master regulators of adipogenesis. So these observations create a justifiable concern regarding risk to human populations. So they leads to a search for evidence of a link or a causal link through epidemiological studies and animal-based research with mixed results. It came up with mixed results, and I'll talk a little bit about that too. So in transition from in vitro studies to animal models that are surrogates for human exposure, the focus will be on specific EDCs. I'll talk a little bit about PFCs and BPAs. So PFCs are widely used to make products more resistant to stains, grease, and water. So they break down very slowly. They take forever to break down, many years and decades, and tend to bioaccumulate, thus can remain in the human tissue for years. They are used in products such as Teflon, cleaners, paint thinners, paint, that sort of thing. Some samples or some classes of PFCs can bind to and activate nuclear receptors, peroxisome proliferator activated receptors, A-alpha, or proliferator activator receptor Y, gamma. So master regulator, these are master regulators of adipogenesis. So effects that can promote adipocyte proliferation and differentiation, I should say. These chemicals also have the potential to alter the methylation status of peroxisome proliferator activator receptor Y gamma and its target genes in ways that promote or impede adipocyte differentiation. So some PFCs can increase glucocorticoid concentrations by inhibiting the degrading enzyme 11-beta hydrosteride dehydrogenase 2, which is also the possibility to raise obesity risk. So BPA is used to create polycarbonate plastics and epoxy resins. The primary exposure route in humans is via bottles, food can linings, food packaging. Maternal BPA is transported across the placenta with much higher concentration in male fetuses. The other thing too is plastics. If you use plastic and you microwave with those plastic, the heat creates more of that problem. So it's not a good thing to microwave food with plastics. Use glass instead, which I'll talk a little bit more about. BPA-induced estrogen receptor signaling is associated with increased expression of histone-modifying enzymes that instigate surges in repressive epigenetic marks and alterations of mitochondrial metabolism following altered DNA methylation. So BPA can have biologically related and possibly alarming outcomes in vivo as well as in vitro. So I'll kind of explain a little bit about that. That kind of comes up to epigenetics, I should say. So that changes the physical structure of DNA. So an example of an epigenetic change is DNA, just like as I mentioned, DNA methylation. So it's an addition of a methyl group or a chemical cap to part of the DNA molecule, which prevents certain genes from being expressed. And another thing is histone modification. So the DNA being expressed, so meaning under methylation. So methyl groups are clusters of hydrocarbons which attach to strands of DNA. So they act as signals along the DNA chain. So they act as signals along it, some turning the genetic activity off and some turning it on. So it could be some things for good things. Okay, we need to turn this off to make sure that this person doesn't receive a sort of cancer or this type of fat or whatever the case may be. But then some genetic markers have to be turned on in order to alleviate some issues. So it's very same way if you think about a hiker hiking along a trail and going along a path in a trail, and then you see the signs that go this way or that way or this way. And if the hiker goes down the wrong path that the sign says not to go down, they could fall down a cliff that's 200 feet deep and end up dying, which is not what we want. So similar situation here. So under histone modification, histones turn the genes of DNA off and on respectively, similar. Either, if you think about a hay bale that's wrapped around by wires, the methylation or the histones turn genes on and off by loosening their tails, therefore allowing transcription factors and other proteins to access the DNA. If the hay bales are tightly wound and wrapped, it can't unfold and you can't access. So a cow can't eat its food if it's too stuck together and really tightly packed. But if you don't restrict that access, it's opened up and then they could express. So DNA can express itself that way. So this is how that works in a kind of a layman's term, I guess. So BPA, BPS, BPF. So its use is growing because manufacturers are replacing BPA with these chemicals. So it's contributing to the frequency of exposure. So remember many years ago, BPA was known as bad, and all the glass bottles and the drinking workout bottles were removed from the market, and those are replaced by bisphenol S and F. And there hasn't been any conclusive studies to say that those are just as unsafe, or they're not as safe or as dangerous, I should say, as BPA, but there are some issues with these ones that haven't been proven in the new ones. So diet and exercise are still understood to be main drivers of obesity, but there are a lot of chemical exposures that play a big role, as I mentioned, over 20% as well, just in those one bisphenols. So body mass outcomes amongst children and adolescents aged 6 to 19 who had a greater level of BPS and BPF in their urine were more likely to have obesity compared to children with lower levels. So transgenerational effects. So EDCs, so this is going down the line of generations. So EDCs could prevent the proper erasure, reestablishment, or maintenance of epigenetic marks during these periods of development and alter the cellular epigenome and increase postnatal disease and susceptibility to obesity. So germline epidemic marks are disrupted. This could result in a transmission of adverse phenotypes across multiple generations. So what I'm going to do, I'm going to pull up this next slide and talk a little bit about how that you can see that visually, how that works. So if a pregnant mother is exposed to an adverse stimulus, like an EDC, her child designated as F1, so you see the FO mother, F1 is her child, and it could be affected or may be affected as a consequence of direct exposure to the same stimulus in utero, because the germ cells of the offspring in F1 are developing throughout gestation, and the grandchildren designated as F2 are also directly exposed. So there's direct exposure to the child and the grandchildren of the mother when she doesn't even know that. So when an exposure occurs through the FO or the F0 father, transgenerational effects are observed in the F2 generation as the only other generation directly exposed to the original stimulus is the future F1 offspring. So the F1 is directly exposed because that's part of the father. That comes from the father, exposed as a germ cell. So effects are seen in the second generation. So F2 would also be considered multi-generational. So in contrast, effects observed in the third generation, so F3, they didn't even have any direct exposure to any EDCs, F3, but it did because the original stimulus would be but it's transgenerational. So now you're going through different generations, and that F3 hasn't even touched any EDCs, supposedly. But according to what F0 did, that's what I mean about how it could demonstrate an adverse effect to children and grandchildren. So challenges to making strong inferences about EDCs and child obesity. So it's sometimes hard to prove some of this, but because of the different factors. So chemical mixtures, exposure misclassification, and confounding are some challenges to making more reliable inferences about the causal links between early life EDC exposure and the link of childhood obesity. So chemical mixtures. Exposure to a mixture of EDCs transpires over a lifespan, like from birth, even before birth, as I mentioned, to death. So yet exposures are mainly examined if they occur in isolation from one another. This one chemical at a time approach has left us with insufficient knowledge about the individual, interactive, and cumulative health effects of EDC mixtures. First, given the vast amount of environmental agents to which humans are exposed, there's so many out there, there's a need to identify the most strongly associated with adverse child health outcomes, and generally when little data is available with the toxicity of individual exposures. And second, multiple EDCs may have a synergistic association with health outcomes by disrupting the homeostasis of compensatory mechanisms. So things that try to compensate and help to make it better, EDCs will disrupt that. So that's not what we want, of course. So finally, cumulative exposure to certain classes of EDCs, such as phthalates, could adversely impact child health when individual components of the mixture act via common biological pathways, and cumulative exposure to these individual agents is sufficient to induce an adverse effect. So misclassification. So the episodic nature of many EDCs exposure and short biological half-lives of their biomarkers can cause exposure misclassification. So this means that it represents like a signal to noise problem, where the misclassification results in a less precise estimate of an individual's exposure and makes it more difficult to rank their exposure relative to other individuals in the study. So if the misclassification is not yet systematically different with respect to childhood health outcomes, then the study will have reduced statistical power to detect an association and observed associations with the attenuation towards the null, and then it becomes insignificant. So it doesn't matter. Where it does, really, in real life, of course. So confounding or distortion of the true relationship, there is potential for confounding factors associated with both early life EDC exposure and child health and obesity, which could create concerns in study results. So socioeconomic factors are important determinants of childhood health in addition to chemical exposure. In the case of obesogens, many strong determinants of adiposity, so example diet, are correlated with lifestyle factors. Example also the maternal diet may be also associated with EDC exposures. To determine if an EDC has obesogenic effects independent of other predictors of obesity, it's necessary to measure and control factors like diet, physical activity, and breastfeeding, etc. And it's necessary to consider potential confounding from other exposures of EDCs, since the effect of one could be misattributed to another pollutant, which is correlated too. So it's tough to find that out, right? So endocrine disruptive screening, so regulatory perspectives and needs. So the American Public Health Association is concerned that the public may be placed at risk because of critical information about potential health effects of endocrine disrupting chemicals to which Americans are exposed are being overlooked in the development of federal guidelines and regulations. So in my opinion, I think that these should be updated, et cetera, and I'll talk a little bit about that more. So more needs to be done to protect the public from potential health risks of exposure to EDCs, and more specifically reflecting the recommendations of the Endocrine Society's scientific statement on EDCs. So APHA, so it urges, supports the Endocrine Society and American Medical Association, proclaiming that more needs to be done to protect the public for potential health risks and exposure to EDCs. Steps should be taken by federal agencies as well, that with regulatory insight for numerous specific EDCs to coordinate and find synergies amongst themselves, to coordinate, cooperate among federal agencies with regulatory oversight with various individual EDCs. So health professionals and scientists with expertise in various aspects of their toxicity, exposure, environmental fate of EDCs through the life cycle of their manufacture, use, distribution, and disposal can be consulted, and active participants in the development of public policies to regulate and restrict EDCs. These may consist of, for example, endocrinologists, toxicologists, occupational environmental medical specialists, epidemiologists, and policymakers. So these public policies further should be based on data that comprehensively include both low-level and high-level exposures. So sometimes it's very difficult to find out about the levels of exposures because that's not generally measured with anybody since birth and before birth. It's a very difficult scenario to get into and to do. So environmental agencies. So more than 3 decades, National Institute of Environmental Health Sciences has been a pioneer in conducting research on the health effects of endocrine disruptors. So the NIEHS supported research that leads to a greater understanding of how endocrine disrupting chemicals may cause disease and obesity. So the NIEHS was involved in developing a consensus statement in 2019 on a clear or a key characteristic of endocrine disrupting chemicals, which provides a framework to help scientists evaluate potential endocrine disruptors. So this leads to cutting-edge research projects on endocrine disrupting chemicals to understand how they work and define their role in health and disease. And the research areas in the progress include developing new models and tools to help better understand how they work, how endocrine disruptors work. Even ones that we don't even know how they work, we need to figure that out, how they work as well. So developing and applying high throughput assays and identifying substances with endocrine disrupting activity. Conducting animal and human health research to define linkages between exposure and endocrine disruptors and health effects, and developing new assessments and biomarkers of exposure and toxicity, and identifying and developing new intervention and prevention strategies. So some mitigation strategies that you can do at home and through nutrition, through household. So one of the big ones that I say to my clients is to eat not necessarily organic, but eat clean, eat less processed foods, and eating clean could be easier said than done, because what's clean mean? It could mean anything to a different person. So that's why it's good to have somebody as a professional, which I'll mention, that knows about this and can help guide people to the right areas in order to help them eat better, not only for the entire society, but for the person as themselves, because each body is individually different in what they need. So eating organic. So where possible, choose food that's been grown organically and reduce the risk of EDC pesticides and fertilizers. Another thing about organic is that can be confusing too, because you can have an apple, for example, from New Zealand that says organic on it, but how long did that apple take to get from New Zealand to the United States or Canada or whatever other country in North America, Mexico? So how long did that take to get there on ship or whatever the case may be? There's chemicals that are still used on these fruits because they're not picked ripe. If they were picked ripe, then they would be not very good by the time they got to the US. So they're sprayed with chemicals in order to ripen up when they get here. So there's a website that you can go to. It's the EWG Dirty Dozen and Plus 15, or sorry, Clean 15. Dirty Dozen and Clean 15. They will give you a good information set on which fruits to buy, better buy organic, and which ones to buy non-organic, so conventional. So it gives you kind of an idea, so you don't have to spend as much money on just all organic. So wash all fresh produce as well. Organic products can still have chemicals due to cross-contaminations from other farms. So taking good care of your thyroid and liver. These are important endocrine organs. So eating enzyme-rich food, but enzymes are also destroyed at cooking at high temperatures. I believe at temperatures over 118 degrees Fahrenheit. And try adding a liver detox during a spring and fall. So liver and thyroid. So enzyme-rich foods are foods like pineapples, papayas, mangoes, honey, like pure honey, bananas, avocados, sauerkraut, miso, kiwi, ginger are some examples that you can do or eat that will create more enzymes or enzyme-rich foods. Clean your drinking water. So filters like a simple activated carbon jug filter or reverse osmosis will get most of the chemicals out of your water. And eat more plants and less animal foods. So many chemicals end up in the greatest concentration in meat, fish, and seafood and other animal products, even organic ones. Limiting these will greatly reduce the intake of endocrine disruptors. And avoiding nonstick cookware, such as so nonstick like Teflon, which I mentioned earlier. So Teflon is known as an endocrine disruptor. So choose stainless steel, cast iron, titanium, or ceramic pans instead of the Teflon pans. Exchange harmful cosmetics and household cleaners to homemade or low toxic options. So detox your home and skincare routine by removing unknown chemicals and cleaners, dangerous plastic containers, pesticides and sprays and fragrances in the cupboard, and refer to EWG's Skin Deep database. And the website's mentioned at the bottom of the screen, which I believe people will get a copy if you get this emailed to you, from what I understand. But so these websites are going to be on the screen. So Skin Deep databases to see how cosmetics score on their toxicity scale. Vacuum your home. So many endocrine disruptors are found in dust. So use an air filter to catch them and eliminate the rest with a HEPA filter vacuum. So the HEPA filter vacuum has a much better filter in it that it works has a lot more fibers than traps a lot more dust, etc. in the filter. Using fewer plastics, as I mentioned before, not microwaving with plastics especially. So most plastics are at risk of leaching out chemicals, including not only drinking bottles, but children's toys and plastic wrap and various recycled plastic items. Store food in glass containers and opt for wooden or cloth toys. I know those are only good for kids when they're 1, but not as a 15-year-old. The 15-year-old wants an iPad, obviously. So do as much as you can to stay away from it. But so learn more from other groups. The Environmental Working Group has important advice for reducing your exposure to EDCs. And the Pediatric Environmental Health Toolkit is useful for all parents as well, as well as the healthcare providers. So the websites are on the bottom of the screen, and please refer to that as you can. So I know there's as you're probably talking about, or you're thinking maybe about me discussing things about avoiding certain cleaners and going organic, but so that could be quite costly. So this is the financial implication of household mitigation. So this kind of talks about how you can still go with the better things and not having to go spend as much money as you absolutely need to. So it's in the best interest for consumers to choose better quality personal care products at higher quality food in order to avoid EDCs as much as possible. And as I mentioned, organic food is typically more expensive than conventional food. Consumer Reports says the price difference between organic and conventional food ranges widely. So on average, organic food costs 47% more. And this could be a hindrance to many families, and I understand that as well. So that's why I always ask people to go to the EWG website with the Clean 15 Dirty Dozen, because you don't have to buy everything organic. But the ones that have the most pesticides, like strawberries, they're probably at the top of the list. They have in the 10s, if not 20s plus different type of pesticides on them. So it's better to buy those organic than conventional. So in many cases, personal care products and food contain words that may be misleading, such as organic or all natural. You see these words that say organic and all natural, when in fact the products maybe only have a small percentage of being organic or natural and safe. And they're more expensive, but not necessarily better in terms of chemical constituents. So all natural, so natural flavors and colors, that could even lead to things like MSG. A lot of these words are hidden amongst other words that are used to cover these not only endocrine disrupting chemicals, but other ones as well. So make sure you be careful when you look at the all natural organic. Conclusions and proposals for recommendations for mitigation of the obesity crisis. So there's epidemiological and clinical evidence that perinatal and postnatal exposure to EDCs has detrimental effects on children. It's without a doubt, it's there. And early life exposure to EDCs may inflict an increased risk of obesity in future life, and possibly through reduced mitochondria and epigenetic dysregulation. So it doesn't only lead to obesity. There's a lot of other things it can lead to, which I mentioned before, a lot of other illnesses, cancer being one of them, which had come out. And even though a person could lead a very healthy lifestyle, as I mentioned earlier, it could be what the grandmother or great-grandmother did that could lead to other things that happen to present-day people and kids. So that's one thing we have to look out for as well. So just be careful with that. Increased endeavors from governments and other stakeholders are necessary to create successful health policy and circulate health instruction program to raise public awareness to protect our youth from the detrimental effects of EDCs. And determining whether observed adverse effect in children are linked to EDCs is a concern. So this is due to absence of enough exposure data. We don't have all the exposure evidence from these things. So when did the parents begin ingesting foods with EDCs? So does anyone know when their grandparents did, or their parents did, or you did? No, it's very difficult to figure that out. Or when the child has been exposed, and for how long has the child been exposed, and to what times? So that's why it's so difficult to figure this out. So data is often limited to accidentally higher exposed groups. So it's only limited to those higher exposed groups, not to all of them. So most exposure information has focused on the presence of persistent organic pollutants in Europe and North America. Data on the scale and trends of global exposure are limited. Potential sources of exposure are through contaminated food and contaminated groundwater, combustion sources, and contaminants in food and consumer products. And there's still more that'll be coming that we don't know about yet. So the best thing we can do is educate, provide information, and deal as much as we can in groups and find out what these issues are and how we can prevent them in the future. So information on exposure during critical development periods of children is generally lacking. So critical development period. So that's when hormonal issues can start, growth cycles, etc. So these exposure data sets that exist are primarily for various environmental media, so air, food, and water, rather than the most relevant internal exposure, like to blood and to tissue, hormonal, to the various glands, etc. So such information is essential to evaluate exposure-response relationships in field and epidemiological studies, and to use these relationships to produce credible risk assessments. Childhood obesity literature should critically examine the interrelationships between chemical and non-chemical stressors which play a role in childhood obesity. Numerous chemical stressors are linked to childhood obesity, as we know. So, however, they do not claim to have exhausted the list of plausible contributors that are yet to be discovered or at the early stages of being linked to the obesity epidemic. So chemical and non-chemical stressors in a child's environment are very complex. So chemical in itself, as I just mentioned, is insanely complex, and the non-chemical ones are the diet, exercise, food, and who knows? Look how complex the food system is, or the food chemistry in the food, and you find so many things online, on magazines and on the news, that this is bad for you today, but tomorrow it's okay, but then the next day after that it's not as good. But the science keeps coming up with different changes because of new things evolving in science that is helping us understand this and get a better grasp on what things could have occurred in the past that are not safe today. So that's, or that were considered safe in the past, that aren't as much today. So that's why we have science to help us through this. So by better understanding the interactions of chemical and non-chemical stressors contributing to child overweight and obesity, community decision makers can be informed on how to promote healthy child-specific environments and provide solutions to help overall improve community health and well-being. And not just individual, but I'm talking community and even to the entire country and the world. So that's kind of where this is very important. So Further exploration required to solve the EDC crisis. So scientific societies play important roles in communicating the risks to physicians and patients and providing materials to help people minimize exposures. This needs to continue. We really need to continue this with primary care physicians, endocrinologists, pediatricians, and reproductive medicine practitioners being provided educational materials for their practices. So they really need to kind of drill this down, get this down. Removal of some chemicals that are occurring, there's many chemicals that have been removed in the past, such as DDT and other chemicals. But the thing is, even though they've been removed decades ago, they still linger in their environment. They're in the soil. They last decades in the soil, or the silt, or etc., and water or fish feed, etc. So that's why you still see these chemicals in many fish, or mercury, or etc. So removal of the chemicals are occurring, but new products are being introduced without disclosing what these products are and whether they've been appropriately tested, calling into question the effectiveness of the regulation of the potential emerging EDCs. So this example, which I mentioned, was the bisphenol A going to F and S. Bisphenol F and S were apt to be safer, but there have been studies that have come out that there's been a bit of a difference, but they're still causing some concerns from even today. So chemicals should be safety tested before on sale in the open market, and not just once or twice, but they should be tested over a term period. And this should include testing for endocrine-like activities at low and long-term doses. Although certain countries and a subset of states in the United States have imposed some of these bans, the fact that EDCs as well are ubiquitous. So they're everywhere. You can't get away from them. You walk outside, you're going to get into them from various chemicals that are out there, from new homes to carpet cleaning, to new carpets, to plastics, to flooring, to whatever the case may be in homes. So it's a global issue, and it requires international partnerships among developed and developing nations. So recommendations beyond research include educating the public, as I said before, the media, politicians, and governmental agencies on ways to keep EDCs out of food, out of water, and air to help protect and protect developing children. Our children are going to be growing into adults. We do not want these concerns in adults as it's getting worse and worse as time is going by, as we see by the stats. So develop industrial partners such as green chemists and others who can create products that test and eliminate potential EDCs. Recognize that EDCs are a global problem and develop international collaborations. Cultivate the next generation of EDC researchers, so green chemists, physicians, public health experts with an expertise in endocrine systems. And funding agencies that need to go beyond the one scientist, one project, and one clinician, one patient perspective to fund team science and healthcare. Funding agencies need to prioritize EDC research in the basic clinical and epidemiological realms, especially consider that the cost of research and prevention will result in substantial cost savings in the treatment and mitigation. So much cheaper to help us now in the research than it is dealing with the issues later, with the health issues and health crisis and obesity with children and the things that go follow the obesity epidemic. And emphasize the need for precaution and prevention.
John, thank you so much. I just really want to express appreciation for all your referencing that you've done throughout this. Just, great to have that backed up by science. And when anybody views this PDF of the slides, you'll see a dozen slides following this of
Yes.
all John's references for this. So there should be some great questions and comments associated with this. So please post them to the question panel that you have right in front of you, and we can talk to John a little bit more. I want to address some of the pollutants and how our situation is even more grave than when you put this presentation together for earlier, John. It was, with COVID, all planes stopped flying. You know, our air cleared, our waters cleared, so many things. We could not have affected that much change that fast worldwide without a worldwide crisis like COVID. So it was a beautiful thing to experience, the quiet, the beauty, how many wild animals were coming out and the birds, etc. But what quickly followed was our current administration's reduction of the EPA standards, environmental standards, just tremendous cuts. And what I began to see was more planes flying and dumping chemicals like crazy. You know, the chemtrails that were coming out were just suddenly the skies were, you know, blurry again, and they weren't so blue. So it's just, you know, we've got big work to do. We've got to behave as activists here for ourselves, for our children, for our communities, for the health of us all. Some of the things that we're seeing currently with the fires on the West Coast and the amount of smoke that's being generated is this smoke is traveling thousands of miles, you know, out into the ocean, to the surrounding Pacific Islands, far to the East Coast, and it's carrying the toxicity that is embedded in that smoke from everything that's burning, from the houses and cars and animals and, oh my gosh, the things that are exploding into the air right now. So I wanted to address another piece, and that was, you know, I was really very interested in your generational effects, John, and can, you know, give an example of different clients that I've worked with, and just within, you know, different family constructs that I'm aware of, that what happens, you know, back in the day, way back in the day when there were arranged marriages, they were arranged for a number of reasons, for financial, for royalty, for status, but for very much for health. So people would be screened, and, you know, if they were a good match, health had to be a thing. What we're seeing now is with marriages, one partner could have very strong genetics, and the person that they're marrying much weaker genetics, and may have patterns in place. For example, mental health concerns like ADHD, depression, diabetes, things like that. So you bring those two together and they start having children, and what you see is the weakening in the food chain, and how it's gone from the mother in this situation of being raised with whole food and really farm related foods, right, from the family, to marrying this man, and then their children start exhibiting ADHD, strong depressive patterns from very early age. Then that diet and environmental concerns weaken, and that generation have kids, and now the next generation has not only ADHD, but strong learning disabilities, incredible depressive episodes. These kids are all on medications from an early age. Autism has come into play very strongly here. So it's, you know, that it's real, what we're facing here in transgenerational, and the impact that you really emphasize, that I appreciate so much, in the diet and lifestyle, and how much that can mitigate, and how some things we don't have control over, and the things that we do, we must seize to the best of our abilities and employ them and start embracing them and sharing the information. So that's, you know, the value of Hawthorn University, and what you're learning, what our students and graduates are doing in their communities now, is really raising this awareness and bringing this information to their clientele, and really seeing changes taking place.
Well, that was very well said. Thank you.
I don't know if you had anything to add to that, but
no, you did it. It was awesome, and I agree with things you cannot control. That's up to you to control. It's almost like having, if you're holding a firearm and your DNA structure, etc., is the gun, but if you pull the trigger, that's your actions of pulling the trigger. What you're doing to possibly, you can make it better, or you can make it worse. So it does. So you're trying to mitigate it as much as you can with with a very good lifestyle and very good diet and exercise, and helping kids understand how exercise and diet is important, and how it'll help them as they get older, and how they can cope with things and cope with the strenuous things that could come across their plate when they get older, or even now as children. Sending kids to school with masks on today. So many kids are getting stressed about it, and how it's creating issues with the parents and such, and going back to school right now. It's scary for them. But if they mitigate and make sure their immune systems are as strong as they possibly can be, that's one up for them, which is a good thing. Yes.
Yeah, absolutely. The mask is an interesting component out here too, anywhere on the West Coast with all the smoke and ash. And
Yes.
do you find within your clientele, John, that there's an increasing apathy and just a sense of, this isn't within my control, and so why bother, kind of an attitude?
Yeah, it's interesting that you say that, because there are, you do have some individuals that will get into that, like some of my clients, but then again, it's when they come see me because they want to, and they want to make changes. But they do believe, some people do believe that a mask won't help them. But I will say, I'll still tell them that science depends on where you look. So, some say it will help, some say it doesn't, but it won't hurt. A mask will not hurt you. It'll actually, even if it microfilters out some, it's better than nothing, right? So that's one example of masks. But with the diet and exercise, I see a lot of people are on board with that, especially here in my city of Calgary, Alberta. We're quite an active city, especially during the summer, and a lot of people try to look after themselves. And we also have a mask law that's mandated here in our city. So if you go anywhere in public indoor space, you need to have a mask on.
Yeah.
But yeah, so.
Out here with the fires and the smoke, it still just stuns me.
Yeah, and it's interesting
walking out without it, and their eyes are blinking,
exactly.
and my throat's a little scratchy, right now, to be able to keep talking, just because of the air quality. But to have their children going out, and I've brought this to their attention. It's like this air is so bad. I go, yeah, I guess, I can't see the house next door. I guess it's kind of bad, worse than usual. So oblivious, it seems.
No, because even our air quality here in Calgary is very, very hazy from the fires there. And I'm about a 4-hour drive north of the Montana border, and we have the major haze. I can't even see across I have a valley behind my house. I can't even see on the other side of the valley because of that. It's really interesting how it travels so far.
It is. It's very broad, and it reminds us that we're how connected we are, right?
Exactly.
Our air is your air.
That's right.
It'll get there. It'll circulate for sure. So you also brought up vacuuming and air filters within a home. I think they just make good sense in general, particularly at times like this. In our fire situation like that. But just given that our air is impacted, like you said, do anything that you can. Any little bit will help mitigate some of the danger.
Exactly.
I wonder about another thing here about the organic and all natural.
Right. Yes.
These are terms that the food industry uses to get away with a lot. All natural means nothing. Right? What isn't natural? A chemical is natural. Chemicals are naturally occurring in our world.
Cocaine is natural. Exactly, that's right. Yeah, for sure. But you don't want to use it now, do you? No. But yeah, that's the thing about the natural. It's all marketing. It's to market to get better sales as well. And of course, I understand the use of the chemicals. Many of these chemicals is to increase shelf life, which is the bottom dollar, which is the thing that matters, right? So. Yeah.
And even if these chemicals are begin to be phased out of USA, we're still selling them and shipping them overseas where they're used there. And then, we're just still perpetuating the cycle. Well, one thing I'd like to propose to all of us is to consider a plastics challenge.
Right.
See if you can go a day, a week, any amount of time without touching plastic, without buying it. It's a huge challenge. It is a huge challenge when we look at everything that is wrapped in plastic.
Exactly.
And I have been a very strong consumer and that, I shop from the bulk bins in my grocery store, etc. But if something's wrapped in plastic, I leave it at the store.
Right.
I'm going to unpack it and I'm going to give it to them, because the store owners aren't going to want to have to deal with that. And if enough of us do, this is a political action. If enough of us do, they will inform the manufacturers that they don't want it like that.
Exactly. That's true. Exactly it. Yeah. That is so true. I like that challenge. I'm going to do that myself as well.
Very good. I'll join you. Do it on a regular basis. I want to compliment you again, John, and I want to indicate, I don't think I said it enough, that, John is a current student in our doctoral science program here at Hawthorn, and this presentation was based on one of his assignments. And his instructor and then the school director became informed of the quality of this and encouraged John to come forward with a presentation. Once I viewed his assignment, I started contacting John immediately. So I just want to say, this is the level of work that Hawthorn students are doing. It's indicative of the level of education they're gaining here at Hawthorn, and the information that they've achieved, and the work that you're achieving in the field with the clients and the community that you're working with to really make a difference. So thank you, John, for everything you did to put this together. And I'm just thrilled to have been able to have you showcase such an important piece of information.
Thank you so much, Paula. That was great. Thank you. I really appreciate that. And I'm learning so much through Hawthorn, and the program is incredible. I'm really appreciating the program and what it's offering and what's happening. It's great. I love it. Thank you.
Thank you. Thank you. I want to remind everybody that this webinar was recorded and it'll be available on the Hawthorn website under archived webinars in just a few days. There'll also be a survey to fill out after the webinar ends, and I appreciate you taking a few minutes to fill it out. It always helps us to have your feedback and any comments about this presentation. So thank you so much for doing that. I want to let you know that our next webinar is on October 6th with Deanna Batdorf, and she is going to be presenting on Ayurvedic nutrition. So I'm super excited about featuring Deanna. She's got a fabulous Ayurvedic center in Sebastopol, California, that unfortunately her doors are closed right now because of COVID, but she's going to bring her information to Hawthorn and share it broadly. And our next All About Alumni will be Wednesday, October 7th at noon Pacific time with Amy Granat. She's a WISE grad from Hawthorn, and she's going to be presenting all about her post-graduation activities. Both of these will be ones to tune into for sure. And saying that, we've had many previous terrific webinars and graduate interview presentations, and you can check those out in our archives too. I sure hope we've inspired you to learn more about health and nutrition with all the webinars we've offered over the years, and certainly this one. And I want to remind you that Hawthorn also provides a variety of nourishing programs and courses, so I encourage you to visit our website for more details. And when you're ready for more personalized attention, you can reach out to our admission advisors. All right, everybody, that's it. It does conclude today's presentation. I want to say how grateful I am to work with James Bernardinelli. He engineers all of our webinars, so thank you so much, James, for everything you do behind the scenes for all of us at Hawthorn. And thanks again, John. I appreciate it so much. And thanks everybody for sharing this educational experience together. I want to wish you all the best. And I sure look forward to learning together more at Hawthorn's webinars and All About Alumni series. And until then, I'm going to be really mindful about endocrine disruptors, as well as compassion and kindness, because you know what we practice grows stronger. So I hope you'll join me in this too. Thanks, everybody. Take good care. It certainly matters now.